Hi, I'm Dr. Joel Dunn, a family medicine doctor in rural central Minnesota. I want to take a minute to talk to you about COVID in our community. COVID's been steadily getting worse in our area for quite some time. Saving lives and reducing the physical and mental health effects of COVID are my top priorities. If I were a small business owner, would my priorities be slightly different? Yeah, they probably would. What is our local COVID situation? It's not good. In the past week, we're averaging 4,400 new COVID cases per day in Minnesota. COVID-related deaths are currently averaging 26 people a day, and both of those numbers are going up incredibly fast. The hospitals and clinics in our area have been almost full for the past several weeks. And those people in the hospital and dying of COVID, they're not random faceless people. They're our neighbors, coworkers, friends, and family. Unless we do something to change it, we're going to run out of space to care for people with serious COVID infections. We need to remember, the more resources we need to spend treating COVID patients, the fewer resources left to take care of the other stuff. Heart attacks, strokes, car accidents, seasonal influenza. It's not just that we'll run out of hospital beds and ventilators. As our COVID numbers go up, we're also running out of staff. Doctors and nurses are getting sick too. If the COVID pandemic was a boxing match, we'd be in the fourth round, and COVID just punched us right in the face. And now we've got to decide, what are we going to do about it? Well, first, we need to listen to trustworthy sources and follow the science on COVID. Who do I trust? The CDC, Johns Hopkins, Minnesota Department of Health, University of Minnesota, Mayo Clinic, my colleagues locally here at CentraCare. Some people get upset when the experts change their minds and make new recommendations. We know a lot more now about COVID than we did back in March. When recommendations change, it's because the experts are using the most up-to-date information to help us fight COVID better. This is a good thing. What else do we need to be doing? Simple things. We need to be washing our hands. Need a reminder on that? Go rewatch the hand washing video I posted way back in April. Can't wash your hands? Use hand sanitizer. We need to be cleaning the high-touch surfaces at home and at work. If you feel sick, go get tested for COVID and stay home. Don't write off your symptoms as just a cold. In 2020, there's no such thing as just a cold. We need to social distance. 6 feet apart, it's not a magic number, it's a guideline. The farther apart we stay, the safer we are. The closer together we get, the more dangerous it is. Let's talk about the elephant in the room. Masks. Everyone who can wear a mask needs to be wearing a mask. Are masks perfect? No. They're hot, they fog your glasses, they give you acne, they're a pain. But do they help? Yes, 100% without a doubt. Wearing masks helps protect our community from COVID-19 spreading. Masks don't make you sick, COVID makes you sick. So wear a mask to protect your family. Wear it because you care about our community. Wear it because you want our small businesses to stay open. Wear a mask because it's the right thing to do. Wearing a mask shouldn't be an individual liberty issue. We give up our individual liberties all the time to help our community. We follow the speed limit, we wear seatbelts, we don't drive drunk. Are you worried about wearing a mask may harm your child? Don't be. Kids are amazingly resilient and adaptable. When masks aren't a big deal for us adults, they aren't a big deal for our kids either. At home, I've got a certain 11-year-old girl with Down syndrome, and she's finally wearing a mask after 8 months of a struggle. Just as important as wearing masks and social distancing, we need to limit social gatherings. For a lot of people, this one's going to be even a bigger deal than masks. especially as we get closer to Thanksgiving and Christmas time. Large super spreader events like political rallies and protests, they're bad, but they aren't the major problem. It's small gatherings outside of our immediate households that seem to be driving up our COVID numbers. Getting together with extended family and friends inside our homes where we feel safe is dangerous. Organized youth sports and activities where masks and social distancing aren't possible. Gathering at church for worship. Getting together in groups outside of our immediate families for any reason is risky. How risky? It depends on several factors. How high is COVID in our community? How many people are getting together? How far away are they traveling to get there? How long will the people be together? Is it an indoor event? Is it an outdoor event? Will people be spaced out? Will they be wearing masks and social distancing? What was people's behavior before they came to the event? And what will people's behavior be at the event? All of these things you need to consider before you decide whether it's safe for you to go or not. Here's one final recommendation. Get a flu shot this year. No, it won't protect you from COVID, but it will decrease the chance that you or someone you love end up in the hospital with influenza. And for every person not in the hospital with influenza, that's one more bed available to treat somebody for COVID. Speaking of shots, there's been some promising reports out there on COVID vaccines in the news recently. But waiting for a vaccine and herd immunity to solve this COVID problem is a huge mistake. Once approved, a COVID vaccination likely won't be available to the general public until next spring. And once it is available, it's going to take several months to get enough people vaccinated for it to make a difference. Am I scared of COVID? No. But I know enough to see the danger to our local community. It's real and it's big. Things are bad, but we can turn this around. Big Rona, as my teenage son likes to call it, is a global problem. But fighting it is a local issue. We decide how to respond. We are the boots on the ground in this fight. So what are you willing to do? What are you willing to sacrifice in order to help our community? Are you willing to wear a mask, even though it drives you crazy? Are you willing to order takeout instead of sitting inside a restaurant? Are you willing to say no thanks when you get invited over to a friend's house to watch a football game? Are you willing to work out from home or wear a mask at the gym? Are you willing to stay at home when the rest of your friends are going out? If you decide to go out with your friends, are you willing to wear a mask and social distance? Are you willing to keep your kids at home from organized sports and activities when masks and social distancing just aren't possible? Are you willing to scale back family gatherings this Christmas, this Thanksgiving? Are you willing to postpone or cancel that family vacation you've been looking forward to all year long? Are you willing to get a flu shot? These are the individual decisions that all of us need to make. If we focus just a little bit more on us and a little bit less on me, these temporary sacrifices will get our community through COVID faster and safer.